Today we're talking about leptospirosis, a classic One Health pathogen that affects wildlife, livestock, companion animals, and people. It's a disease that crosses species, crosses environments, and shows up in everything from dogs to cattle to marine mammals. By the end of this session, you'll have a clear understanding of how leptospirosis spreads, what it looks like in different species, how we diagnose it, and how we prevent it. This is one of those diseases where understanding the ecology is just as important as understanding the microbiology. Leptospira are thin, tightly coiled spirochetes with hooked ends. They're highly motile thanks to periplasmic flagella. A key feature is environmental survival. These bacteria can persist for weeks to months in moist soil or water contaminated with urine from infected animals. There are hundreds of serovars, and many are host adapted, meaning certain wildlife or livestock species maintain the organism and shed it chronically. Transmission is almost always linked to urine. Infected animals shed leptospira in their urine, contaminating puddles, ponds, soil, and feed. Animals become infected through mucous membranes or broken skin. Even tiny abrasions are enough. Risk skyrockets after heavy rainfall or flooding because contaminated water spreads widely. This is well documented in both animals and humans. Rodents, especially rats, are major reservoirs worldwide, but many species, livestock, wildlife, dogs, can shed the organism. Rodents are the most important global reservoir. They shed leptospira for months to years without showing signs. Cattle and pigs are also major reservoirs, especially for reproductive serovars. Feral swine are increasingly important in the U.S. and can infect livestock, pets, and people. Marine mammals, including sea lions and seals, experience seasonal outbreaks and can shed the organism into coastal waters. After entering through skin or mucous membranes, leptospira spread through the bloodstream. This septicemic phase can cause fever, lethargy, and muscle pain. The bacteria then localize in the kidneys and sometimes the liver, eyes, or reproductive tract. Animals that survive may continue to shed the organism in urine for weeks to months, even after clinical recovery. This chronic shedding is what maintains environmental contamination. Dogs are highly susceptible. Early signs include fever, depression, lethargy, and muscle pain. As the disease progresses, you may see vomiting, dehydration, jaundice, and signs of acute kidney injury. Back pain is common due to renal inflammation. Dogs can shed leptospira for up to 3 months if not fully treated. In cattle, goats, and sheep, leptospirosis is primarily a reproductive disease. You'll see abortions, stillbirths, weak calves or kids, and fertility. Cows may return to heat after being confirmed pregnant, a classic sign of early embryonic loss. Chronic infections are common and economically significant. Horses can develop fever and kidney disease, but the hallmark is recurrent uveitis, moon blindness. Leptospirosis is one of the most common infectious causes of equine uveitis in the U.S. Abortion can also occur, especially in late gestation. In pigs, leptospirosis is a major cause of reproductive loss. Abortions, stillbirths, and weak piglets are common. Feral swine are an important reservoir and can transmit infection to domestic herds and even to hunters or dogs that contact contaminated environments. Cats rarely show clinical signs, but outdoor cats can become infected through contact with rodents or contaminated water. They may shed the organism for months to years, contributing to environmental contamination. Wildlife species often carry the organism without illness, making them silent reservoirs. PCR is most useful early in infection before antibodies develop. It detects leptospiral DNA in blood or urine. MAT, the microscopic agglutination test, is the standard serologic test. A fourfold rise in paired titers is diagnostic. Because shedding can be intermittent, urine PCR is often more sensitive than culture. Early antibiotic treatment improves outcomes and reduces the risk of kidney or liver damage. Doxycycline is the drug of choice because it clears renal shedding. Penicillins are effective for acute illness but may not eliminate carrier status. Supportive care, fluids, antiemetics, nutritional support is essential for animals with kidney injury. Vaccination is available for dogs, cattle, sheep, goats, pigs, and horses in the U.S. It doesn't cover every serovar, but it significantly reduces disease severity and shedding. Rodent control is critical. Rodents are major reservoirs. Livestock management practices include providing clean water, avoiding co-grazing with pigs, quarantining new animals, and avoiding shared breeding stock. Leptospirosis is a significant zoonotic disease. People become infected through contact with contaminated water or animal urine, especially after heavy rainfall or flooding. Veterinarians, farm workers, and pet owners are at higher risk. PPE, hand hygiene, and proper disinfection, including 1 to 10 bleach solutions, are essential when handling infected animals or contaminated environments. To wrap up, leptospirosis is a classic One Health pathogen that affects multiple species and thrives at the intersection of animals, water, and the environment. Understanding reservoir hosts, environmental survival, and species-specific disease patterns is key to diagnosis and prevention. Vaccination, rodent control, and good management practices are the foundation of leptospirosis control in both animals and livestock. If you found this video helpful, please like and subscribe. Thanks, and I'll see you next time.